The SleepView portable sleep monitor is remarkably small, light, and easy to use. This Type 3 device helps you expand the reach of your sleep services. SleepView uses the American Academy of Sleep Medicine recommended channel set. The 7 dedicated channels include heart rate, pulse oximetry, pressure-based airflow, airflow from thermistor, snore derived from airflow, respiratory effort belt, body position. SleepView is ergonomically designed for patients to perform a self-test at home. SleepView works hand-in-hand with the eCrystal PSG Web Portal, where sleep studies are uploaded for review, scoring, and interpretation into a sleep study report. This practical and efficient patient monitoring system allows physicians to provide their patients with a continuum of care for sleep disorders. First, the patient's healthcare provider interviews the patient about his sleep health and medical history. If the physician prescribes a home sleep test for the patient and it is determined that the patient is qualified for one, the SleepView kit is given to the patient with easy instructions for the self-administered home test. The patient brings the SleepView kit home with the SleepView device already attached to all the required sensors, except the nasal cannula, which is in a sealed bag. The respiratory effort belt wraps around the patient's chest so that the attached SleepView is positioned in the center of the chest. If a thermistor is provided, the free end of the thermistor is first inserted into the nasal cannula. The prongs of the nasal cannula are inserted into the patient's nostrils, with the oral tube bending down towards the patient's mouth. The cannula connector is twisted into the SleepView. The patient's finger is placed in the pulse ox sensor. The SleepView is programmed by your physician to automatically start recording at the normal time you go to sleep and turn off at the normal time you wake up. The entire hookup for the home sleep test takes a few minutes, and the patient sleeps in the privacy and comfort of his own bed. The patient then returns the SleepView kit to the physician's office staff, who upload the sleep study data from the SleepView to the eCrystal PSG Web Portal. The data is displayed for analysis in the same PSG software that is used by sleep labs and can be manually scored. A qualified sleep technologist reviews and scores this data and generates a preliminary report. A board-certified sleep physician interprets this information, and the prescribing physician is notified when a sleep study report is ready. Finally, follow-up discussions are held with the patient to evaluate their sleep health and therapy as often as needed. With SleepView, the physician can maintain management of the patient's sleep health. By assigning the patient to a self-administered home sleep test, they are not subjected to a long wait for an appointment in the sleep lab and can receive a quicker diagnosis, which leads to faster treatment and efficient continuum of care for the patient. Learn more about SleepView by visiting clevemed.com/SleepView.